Diabetes mellitus is a group of metabolic disorders characterized by chronic hyperglycemia. It results from decreased insulin secretion, decreased insulin action, or increased hepatic glucose production. This leads to long-term multi-organ complications affecting eyes, kidneys, nerves, and heart. Diabetes is a leading cause of end-stage renal disease, blindness, and non-traumatic amputations. It significantly increases the risk of cardiovascular disease, which is the leading cause of death. Globally, 537 million adults were affected in 2021, with nearly 50% undiagnosed in low- and middle-income countries. Type 1 diabetes mellitus is caused by autoimmune destruction of beta cells, leading to absolute insulin deficiency. It typically presents in childhood or young adults and may progress through stages before overt disease. Type 2 diabetes mellitus involves insulin resistance with relative insulin deficiency. It is strongly associated with obesity, aging, and genetic predisposition. Other specific types include monogenic diabetes, pancreatic disease, endocrinopathies, and drug-induced diabetes. Gestational diabetes mellitus occurs during the second or third trimester due to pregnancy-induced insulin resistance. Prediabetes includes impaired fasting glucose, impaired glucose tolerance, and hemoglobin A1C between 5.7 and 6.4%. Diagnosis of diabetes requires any one abnormal test, such as hemoglobin A1C of at least 6.5%. Fasting plasma glucose of at least 126 milligrams per deciliter confirms diabetes. 2-hour oral glucose tolerance test value of at least 200 milligrams per deciliter is diagnostic. Random glucose of at least 200 milligrams per deciliter with symptoms confirms diagnosis. Diagnosis should be confirmed on a separate day unless hyperglycemia is unequivocal. Screening is recommended for all adults aged 35 years or older every 3 years. Glucose homeostasis depends on balance between intake, hepatic production, and peripheral utilization. Insulin is the most important hormone that lowers blood glucose and promotes anabolism. Glucagon increases hepatic glucose production during fasting states. During fasting, insulin decreases and glucagon increases to maintain glucose levels. During the postprandial state, insulin rises and promotes glucose uptake in skeletal muscle. Insulin is synthesized in beta cells as proproinsulin and processed to insulin and C-peptide. Glucose stimulates insulin secretion through ATP-sensitive potassium channel closure and calcium influx. Insulin acts via a tyrosine kinase receptor to increase glucose uptake through GLUT4 translocation. In type 1 diabetes mellitus, CD8-positive T cells destroy beta cells leading to insulin deficiency. Patients may present acutely with diabetic ketoacidosis due to absolute insulin deficiency. In type 2 diabetes mellitus, insulin resistance leads to compensatory hyperinsulinemia initially. Progressive beta cell failure leads to worsening hyperglycemia over time. Major mechanisms include reduced peripheral glucose uptake and increased hepatic glucose production. Obesity contributes through increased free fatty acids and inflammatory adipokines. Dyslipidemia in diabetes includes increased triglycerides, decreased high-density lipoprotein, and small, dense, low-density lipoprotein. Lifestyle modification with weight loss of 5 to 7% and 150 minutes of exercise per week reduces diabetes risk by 58%. Metformin reduces progression to diabetes by approximately 31%. Clinical takeaway is that diabetes is a progressive metabolic disease requiring early diagnosis and targeted pathophysiologic treatment.